everyone. My name is Sarah Farber, and as Peter said, I will be discussing the systemic failures and structural violence and the impact on young female immigrants and asylum seekers in New York City. So here is the overview today, and I will get right into the background. So young female immigrants and asylum seekers aged 18 to 25 face immediate vulnerability to homelessness and sexual exploitation once they arrive in New York City. They encounter multiple forms of violence, being political, interpersonal, and cultural. Galtong's concept of structural violence explains how systems create barriers that prevent these women from meeting their basic needs, like safety, housing, and healthcare. Fear of deportation often stops them from seeking help or reporting abuse. Languages and cultural barriers increase their isolation, and shelters intended as safe spaces have in some cases become sites of trafficking. The current political climate adds further fear and instability. While policies such as the right to shelter and the Trafficking Victims Protection Act provide some protection, they remain insufficient. The stigma and trauma persist, leaving many without the support in which they need. This study aims to understand the lived experiences of these young women who become homeless or sexually exploited due to gaps and failures in government protections. So this conflict involves a complex network of actors and systems shaping the experiences of these young women in New York City. At the center are the women themselves, facing challenges related to immigration, gender, and age amid fragmented support systems. Secondary actors include nonprofits, healthcare providers, shelter staff, and government agencies, all struggling with limited resources and coordination. Tertiary actors, such as the public, media, faith groups, and employers, influence perceptions and treatment, often through stigma or advocacy. These actors operate within four main systems: political, economic, cultural, and security. And as we can see here, the blue boxes, those are political and government, and those have the largest impact. So relationships between these groups are often strained by mistrust and poor communication. For example, nonprofits may depend on government agencies, but find coordination difficult, and immigrant communities often distrust law enforcement. This map highlights key pressure points where coordinated interventions can address system failures. So I used a qualitative, theory-informed conflict analysis approach to explore the lived experiences of these young women in New York City. Rather than formal interviews, I drew from media reports, advocacy publications, personal narratives, and artistic expression to understand both what is voiced and what remains silenced. Across these sources, I identified recurring patterns of fear, trauma, systemic neglect, and institutional mistrust. These were grouped into key themes, including cultural invisibility, emotional isolation, and reactivated trauma. These are not just emotional experiences, but rather indicators of larger systemic failure. To interpret these findings, I applied several theoretical frameworks. First, Galtong's theory of structural violence, which explains how institutions create barriers that prevent people from accessing basic needs like safety and shelter. CMM theory helped me explain how meaning is shaped through repeated patterns of interaction, particularly in systems that ignore or silence marginalized groups. I used tools like the charm loop to identify missing stories and cycles of mistrust, and the serpentine model to trace how these patterns unfold in a back and forth, co-constructed manner over time. I also drew on intersectionality to explore how overlapping identities, such as gender, immigration status, and age, intensify vulnerability. The conflict tree allowed me to map surface-level symptoms, like homelessness, back to their deeper roots, including policy failures and unresolved trauma. As you take a look at these tools, pay close attention to the artistic elements, as they are directly linked to lived experience. These frameworks helped me move beyond individual stories to understand the deeper patterns that shape this conflict and informed the interventions I propose. So my first intervention strategy addresses one of the most urgent needs identified in this conflict: the lack of access to safe, trauma-informed healthcare and shelter services for young female immigrants and asylum seekers in New York City. These women face barriers like language, documentation issues, fear of deportation, and deep mistrust, forms of structural violence that increase their risk of exploitation and homelessness. Existing services like New York City Care and the Right to Shelter Act often fall short. Many women do not know that they're eligible, and some avoid shelters due to safety concerns, including trafficking reports. I propose a citywide task force and municipal policy framework to implement trauma-informed, culturally responsive practices across key agencies, like Mayor's Office of Immigrant Affairs, New York City Health and Hospitals, Department of Homeless Services, among others. The plan has three phases: coordination and planning, aligning agencies and centering lived experiences; a 12-month pilot in selected shelters and clinics with trauma-informed outreach, safety audits, and ombuds embedded in hospitals for confidential feedback; institutionalizing and expanding these standards with secured funding and formal agreements. Inspired by models like California's Medi-Cal expansion and Columbia's Justice Ambassadors, this approach ensures immigrant women shape the programs designed for them. Though it requires around 20 million, this investment is cost-effective compared to emergency and public safety costs. The framework operates on interpersonal, institutional, and policy levels, aiming to rebuild trust and provide consistent, culturally safe care. Often, immigrant and asylum-seeking women fear speaking out due to deportation risks. Photo Voice offers a safe creative outlet where women can share their stories anonymously through photography. This process not only builds community among participants, but also raises public awareness of the challenges they face, like homelessness and exploitation. Through exhibitions and partnerships with policymakers and nonprofits, Photo Voice helps translate personal stories into advocacy and policy change. Trauma-informed support and training are central, ensuring participants feel safe and empowered throughout the process. Ultimately, this intervention transforms silent women into agents of change. Immigrant and asylum-seeking women in New York City health and hospitals often feel vulnerable seeking help due to fear, trauma, and systemic barriers. This intervention proposes organizational ombuds offices at every facility to provide a neutral, confidential resource for patients and staff to raise concerns and seek resolution safely. Unlike social workers or patient advocates, ombuds focus on systemic patterns and institutional fairness, helping to identify and prevent conflicts before they escalate. These offices can be embedded within hospitals or outsourced based on each facility's needs, staffed by trauma-informed professionals trained in cultural humility and immigration law. By building trust and accountability, ombuds offices promote a safer, more equitable healthcare environment, supporting both vulnerable patients and healthcare workers while informing policy improvements. This intervention strengthens the entire system and fosters long-term institutional resilience. My network map centers on young immigrant and asylum-seeking women, surrounded by a web of institutional stakeholders with varying power and influence. Nonprofits and healthcare providers maintain trusted connections, yet powerful actors like the NYPD and immigration enforcement operate in isolated cliques with little accountability. Exploitive actors such as traffickers maintain harmful relationships where institutional support fails. Bridging actors like ombuds offices and journalists can help connect fragmented clusters, fostering trust and accountability. Currently, the network is fractured by mistrust, siloed communication, and power imbalances, limiting coordinated intervention. Building social capital and mutual accountability across the network is critical to break cycles of neglect and create sustainable support systems. So these interventions face challenges like political shifts, funding limits, and institutional resistance. To sustain impact, it's vital to identify who bridges communication gaps and builds cultural legitimacy, especially with immigrant and asylum-seeking women. Strategies include embedding participatory networks, reflective learning, and standardizing ombuds offices with strong evaluation and charters. Centering lived experiences in policymaking using a proximity lens approach will help create an adaptable, resilient system. Scenario planning considers three paths: an ideal world with strong leadership and integration, a realistic path with gradual progress, and a negative scenario where reforms roll back and mistrust deepens. Monitoring and evaluation will span 30 to 36 months using multiple methods. The task force will track interagency collaboration, challenges, and successes, ensuring transparency. Shelters and hospitals will undergo quarterly audits to assess trauma-informed care, safety, and cultural competency. Photo Voice participants will have bi-monthly debriefs and participate in anonymous surveys to ensure their safety and empowerment. Ombuds offices will provide biannual summaries highlighting trends confidentially. A volunteer conflict sensitivity group will oversee ongoing data to ensure interventions remain inclusive and responsive, and successes will be measured through both data and lived experiences, aiming to break the cycle of structural violence by improving access, trust, and societal perceptions. My findings show that this conflict is deeply rooted in systemic and structural violence, with institutions responding in fragmented, often inadequate ways. This leaves young female asylum seekers vulnerable and highlights a clear need for trauma-informed, gender-sensitive interventions. In terms of limitations, I wasn't able to conduct interviews, which limited firsthand voices. There's also the risk of framing communities in terms of what they lack, and the New York City scope means findings may not generalize elsewhere. For future research, I'd recommend centering lived experience in evaluation, exploring ethical storytelling as a method, and comparing approaches across different cities to access scalability and effectiveness. And thank you so much for listening. I'm happy to answer any questions or discuss further.